Sounds like I'm on. Okay, great. So it's great to be here again. Thank you, as always, for hosting and putting this together so that we, those of us who study and have an interest in this topic, can get together. I think I'm really glad to see that our CDC emergency operations number has showed up in a number of today's presentations, and I thought I'd just take a minute to kind of pull the curtain back and tell you what happens on the other side of that number. So when you call in to our emergency operations center, which is staffed 24/7, people call in for all kinds of things. We have watch officers that take those calls. We have triage protocols in place, and so they know they hear Amoeba or Naegleria or any kind of other trigger word, they can go and pull up that protocol and they know who to contact. I do have a cadre of EIS officers, which is a training program that I came into at CDC, and essentially for those of you in medicine, this is kind of like our residents at CDC, and so they're taking the frontline calls. A lot of them are physicians, some are veterinarians, some are PhDs in other disciplines, and so they kind of take the initial history from whoever's calling in, but then eventually all paths do lead to me, and I do hear about all the inquiries that come in. I discuss them with the EIS officer taking the call, and we decide what to do based on the information we've received. So that's a little bit of what happens when you call that number. So since we haven't gotten together here now for 2 years, I thought I'd just kind of go through an update of what we've been working on at CDC as it relates to Naegleria fowleri. So I'll go through the current case count. I'll update you on the cases that have occurred last year as well as so far this year. And then I'll talk about 2 projects, an analysis of geographic and environmental factors, as well as a global PAM case series. So a lot of you are probably familiar with this figure. It is up on our website. It is our basic figure for tracking the number of cases. So I wanted to spend a few minutes providing updates on PAM cases that have occurred since we last met. And in 2018, we did confirm 2 PAM cases. That brings the total number of PAM cases from 1962 through 2018 to 145. That is the most recent data that's posted, because 2019 obviously has not completely ended yet. We do our updates at the beginning of the year after the year has concluded. So 2019 data will be updated early next year. So starting off with the first case of last year, this came in on September 20th. We got the call, our on-call EIS officer received the call from the CDC Emergency Operations Center. This is coming from a critical care physician in New Jersey who was caring for a 29-year-old man with a very fulminant meningitis, very elevated intracranial pressure that actually required a craniectomy to try to control. When we started asking about possible water exposures in this case, we learned that he had traveled to Texas with a group of friends. They had stayed in Austin, but traveled up to the Waco, Texas area to this BSR cable park, which had actually just opened a surf park that summer. The surf park, which you see pictured here, is a venue with some really new technology for making waves. Apparently this place is getting rave reviews in the surfing community for really great surfable waves, but this group of friends had booked 2 hours of time to learn how to surf here, and he reported by his friends did fall off a number of times into the water. So because of this kind of novel recreational water exposure, we did actually go out on September 26th. My environmental microbiology and engineering colleague, Dr. Mia Mattioli, and I departed for Waco, Texas to actually conduct an on-site investigation at this surf park facility. So this is a kind of an aerial picture of the facility and taken from the BSR Cable Park website. There's a lot going on here. So the original feature was up there in the upper right corner, the cable park. So this was Initially a ranch with a stock pond, so the stock pond is now the cable park. I think you guys here in Florida are familiar with cable parks, but they're, instead of needing a boat to pull you around to water ski or wakeboard, you have a cable system that pulls you around. So that's there. That's what the one labeled cable park is. This is a natural pond setting. They do not do any water treatment there. The next one you see is the Royal Flush Slides. These are very steep water slides. If you go on YouTube and Google it or search it, you will see a number of videos posted of people coming down these slides. It does enter into a pool, which they reported that they did chlorinate that pool that the slides enter into. The main feature on here is the surf park, which you see there, and then it's a little bit harder to see, but the surf park is encircled by a lazy river feature. And so I have a few pictures that we took when we were on site. So you see the water slides there, the cable park in the middle with some of the ramps that are there, and then the lazy river feature. So as I said, both the slides, the lazy river, and then the surf park were all reported to have been chlorinated. They manually added chlorine, powdered chlorine. They would add it in the evenings about twice a week, and then they would check the levels the following morning. This actually is a picture of the reservoir. So the water source for all of these water features was actually, the original source is groundwater wells on the ranch property, but they would pump the water out of the wells into this kind of reservoir that they created, which is actually were just these dirt piles that were created after they dug out these water venues, and they lined it with PVC liner and created these reservoirs. So even if the water was starting out underground, potentially protected from the environment, once they were in these reservoirs, they were certainly open to, completely open to the environment and having Naegleria fowleri enter. So we did go on site, as I said, to get a sense of the management and operations and water treatment practices. This is a photo of myself and Dr. Mia Mattioli doing some of the testing. I helped out with doing some of the basic water quality testing. What you see Mia doing here is setting up our ultrafiltration process. This is our way of being able to take large volume water samples. So if you can imagine you're trying to detect something in a large body of water that might not be present in very high concentrations, if you're only taking a typical grab sample, which is about a liter, you might not detect it unless you get hundreds of liters of water. But logistically that's challenging. Obviously we bring a lot of water back to our laboratory. So this ultrafilter allows us to pump through water, and then what's in the water gets collected on the membranes of the filter. The rest of the water gets pumped out, and then we just have to take the filter back to the lab and then process that and can detect things. So here are our results, and I'll highlight a few things. The only place we actually detected specifically Naegleria fowleri was in the cable park. And this, if you recall, this is the one that was pretty much like a natural pond setting. They did not report treating this water. We detected Naegleria fowleri in sediment and ultrafiltered water from the cable park. However, we did detect viable thermophilic amoeba in the reservoir, the surf park, and the Royal Flush water slide water. So our interpretation of this is, so they're viable, meaning they're living. They're thermophilic, meaning they are similar to Naegleria fowleri in that they're heat-loving, but they were not specifically Naegleria fowleri. They could have been another Naegleria species or another type of free-living amoeba. Basically, what our interpretation of this is that the conditions were supportive in these water features for the growth of Naegleria fowleri and other related amoebas. The reason we might not have detected on that day has to do with the fact often, we are never there at the exact time that the case is exposed. We're usually there a few weeks. In this case, we were there probably 3 to 4 weeks after the patient had been there. Obviously, conditions change in that time. There might have been additional water treatment that was done in the intervening time, and so these are some reasons why we might not detect it. But that being said, given the reported water exposure and the conditions we found, we still think this surf park, and we did find out that patient had not gone in any of the other water venues, so he had only been in the surf park at this facility. Oop. Oh, could I go back to that table? Sorry. One more back. Thank you. So I will point out that we did do some basic water quality showing that even in the venues that they reported treating the water, the surf park and the lazy river, we did not detect any free chlorine on the day we were there. And then also, these had pretty high turbidity. Turbidity is a measure of the haziness or cloudiness of a fluid. And why this is important for treatment of recreational water is if you have a lot of dissolved organic solids in water, your disinfection is going to be eaten up by that, and it's not going to be there to help kill the pathogens that you want it to work against. You can see the surf park was incredibly turbid. It had a sandy beach, which was likely contributing to the turbidity of that water. The water was not clear at all. It's also a safety hazard with pools. Swimming pool regulations require the turbidity of swimming pool water to be on the order of drinking water, which is essentially clear. And part of that is for what I mentioned about disinfection, but it's also about safety. If somebody is in trouble in the water and they're on the bottom of the pool, and no one can see them because the water's not clear, that's a safety hazard. So, and on a side note, this facility has actually had 2 drownings associated with it. So it goes beyond Naegleria here. You'll note the Royal Flush and the Lazy River were also had quite turbid water. So moving on to the second case of 2018, this was in California. On the evening of Thursday, November 1st, we received a call again through our Emergency Operations Center about an 8-year-old male who had presented with headache, fever, and vomiting. In the approximately 12 days prior to the illness onset, the patient and their family had been in Inyo County, which is in the eastern Sierra Nevada region of California, and they had been in a hot spring area that was known locally as the Hot Ditch, and it was frequented by locals and tourists and had been so for decades. It was a known area. The way it's been described to me is the hot spring water kind of fills these streams and pools that are alongside the road, and people just pull off and go swimming or soaking in these hot ditch pools. So we did, this was the 9th PAM case in California with exposure to hot spring water. In response to this case, the Inyo County Health and Human Services immediately put out a press release to inform and warn the general public about the potential for Naegleria infection from swimming in these hot ditch natural pools. And they posted warning signs at each of the pools to alert visitors. And here's a picture of one of those signs posted in both English and Spanish. And just of note, this case actually was just published yesterday in CDC's MMWR as a short case report. One of the things I do want to highlight with this case is, if you didn't catch it, this call came in on November 1st. And so we talk about this being a warm weather, summertime illness, but when it comes to hot spring water, it can really be any time of year. So that brings us to this year, where we've now had 2 confirmed cases. The first came in July, on July 21st. Again, notified via our EOC about a possible PAM case in a 59-year-old man with exposure to a water park in Cumberland, North Carolina. This is an area in the southeast portion of the state that includes the city of Fayetteville and Fort Bragg. The patient was actually from North Carolina, but from a different part of the state, and had been participating in a church mission trip, and they wrapped up their trip with a visit to this water park. The group's activities at the water park had included swimming, jumping off the high dive area, volleyball that was set up in the water, and ropes that allowed you to swing and fall into the water. We did not actually go out on site for this investigation, but the state and local health departments were able to ask some questions about this facility and did confirm it is not a chlorinated or disinfected facility. The park is about 60 years old, 6.5 acres, with the deepest point in the water being 12 feet. The water source is actually a nearby adjacent lake, which is spring-fed, And the water park lake, so that lake fills up the water park lake. They drain it at the end of every summer. It sits dry over the winter, and then they refill it. The only reported cleaning or disinfection that they do is using bleach on the actual water slides, and they use copper sulfate as an algicide, which they apply at the base of the slides every couple of weeks to control any algae growth. And then, as you've heard, we actually did just confirm our second PAM case of the year just 2 days ago. This is a case out of Texas and is actually actively still being investigated. The reported exposure was in the Brazos River south of the Dallas-Fort Worth area. So moving on to the two projects I mentioned, the first is an analysis of geographic and environmental factors associated with PAM cases. This is actually a project we've been trying to get off the ground for a number of years with kind of fits and starts. I currently have an EIS officer who's taken this up and helped me put together these slides, and she will eventually get this published for us. But we took a look at a few things. The first thing is, we get asked a lot, is the number of PAM cases increasing in the United States? And when we looked at this statistically, looking from the time period of 1978 when our free living amoeba lab at CDC was established, so basically when there was like a national reference lab established to be able to make these diagnoses, going up through 2018, we haven't seen any statistically significant trends of increasing numbers. However, when we compare cases before 2010, you see them here in blue, in the blue dots, and where they occurred prior to 2010, to cases after 2010, which are now pictured here in orange, we do see that the geographic distribution appears to be moving north. We did attempt to look at this distribution using some statistical software called SAT-SCAN, which looks for spatial, temporal, and space-time scan statistics. As always with PAM, we are always hampered by our small numbers, and so we didn't find any statistically significant findings with that software, but from a descriptive standpoint, we can clearly see that there have been cases outside of the traditional areas. And the majority of northern cases have occurred in more recent years. So this figure has the year on the x-axis with the latitude on the y-axis. And you see, as you move to the right in more recent years, those northern cases occurring in Minnesota and Indiana and Maryland have occurred in more recent years. Another part of this analysis looked at temperatures and precipitation levels of PAM case exposures that were associated with lakes, rivers, and other outdoor aquatic venues. For this analysis, we used National Oceanic and Atmospheric Administration's National Climatic Data Center via the Climate Data Online web portal. So what we did for this is we picked we found the weather station that was closest to the reported GPS coordinates of the exposure location. So here we found that the high temperatures in the 2 weeks before exposure had a wide range from 67 degrees Fahrenheit up to 113 degrees Fahrenheit, and that's displayed on the figure there, where you see on the x-axis the days before exposure, so 2 weeks before, and then the temperature on the y-axis. The color indicates the range of temperatures, and then the line is the average temperature. We also looked at low temperatures. So low temperatures ranged from 40 degrees to 89 degrees Fahrenheit. So you see that additional figure now looking at low temperatures. And then for cumulative precipitation levels, those ranged anywhere from 0 inches to nearly 6 inches in the 2 weeks before the patient's exposure. So these data unfortunately do not support a safe temperature for Naegleria fowleri exposure, meaning if you're below a certain temperature that the water is then safe, or any specific association with precipitation. And then finally, this analysis looked at the size of lakes that were reported for PAM exposures. So when we compared it with a national sample of lakes, PAM exposures occurred more often in large lakes. So you'll see in the blue is a sample of national lakes, the APA National Lakes Assessment, and you see most lakes fall anywhere from 2.5 to 125 acres. But if you look at lakes where PAM case exposures were reported, you see most of them happened in very large lakes. And what I think this actually is showing, not that large lakes are particularly have more Naegleria fowleri in them. It's probably just that large lakes attract more people. They're usually beaches on large lakes. There's probably more boating and water skiing and wakeboarding that are happening on larger lakes. So I think that's my theory on why that we see that. So moving on to the last thing I want to talk about, the Global PAM case series. So I think a lot of you have seen we've done a lot of summarizing of cases that occur in the United States, and then there's a lot of reports from other parts of the world, so we kind of wanted to put it all together and try to estimate the global incidence of PAM, characterize the epidemiology of PAM outside the United States, and describe clinical characteristics of PAM patients around the world. And the methods we used for this were a literature search of published PAM case reports and cases that are reported to our free-living amoeba surveillance system or diagnosed through our laboratory. We recognize that literature search has limitations. Obviously, a case first has to be diagnosed, and then it has to be written up and published. So that's many steps to happen for something to end up in the literature. But we don't have access to any surveillance data outside of the United States, and for the most part, there's really no active surveillance that's done in other countries. So we really just have the literature to rely on, but we recognize that this will be an underestimate. So through these methods, we identified that there are currently 380 PAM cases reported, and they are noted here on this map. And more than half of cases were reported from 3 countries. So 41% came out of the United States, 11% out of Pakistan, and 9% out of Mexico. And what this likely represents is a surveillance bias. These are countries that have awareness and capabilities for diagnosing PAM infections, not that these countries are at higher risk than other parts of the world. We found that the average number of reported cases increased an average of 1.6% per year. The time period for this analysis started in 1965, which was the year of the first published case report, and goes through 2016. The reason we go through 2016 is this accounts for an average of a 2-year delay to publication. So a case that occurred in 2018 has likely not been published in the literature yet. The number of cases diagnosed with a confirmatory test, those are the cases colored in orange, increased an average of 4.4% per year. We considered confirmatory testing to be some type of immunohistochemistry or immunofluorescence testing, PCR, or whole genome sequencing. And then here we looked at the number of cases. We found that the number of cases with an antemortem or a before death diagnosis, these are colored in green now. This increased an average of 3.5% per year. We think this is an important thing to look at because obviously if you don't make a diagnosis before death, there's no chance for initiating the proper treatment. And so I think what this represents is overall increasing awareness to see this increase in pre-death diagnoses. The most commonly reported exposures were swimming and diving. At over half of cases reported some sort of swimming or diving, followed by bathing. This term was used in a lot of the international case reports. Bathing might actually also reflect swimming. It's just a different terminology that's used. Water sports, nasal irrigation, splashing, and other were the additional reported exposures. The most commonly reported water sources were almost half reported a lake, pond, or reservoir exposure, and then that dropped down to the next level of the next one reported were swimming pools, drinking water, canal, ditch, or puddle, river, stream, geothermal water, and other. We looked at, we compared case-patient demographics in the United States to those internationally, and we found that they were generally similar. It's a young median age globally at 14 years, and this is very similar to the median age in the United States of 12. We also see the male predominance in the global case series. Again, both of them around over 3/4 male. We also went and created some classifications and characterized patients as confirmed, probable, or suspect cases. So cases were classified as confirmed if they had identification of Naegleria fowleri in CSF or brain tissue using one of the confirmatory tests, which included immunohistochemistry, indirect immunofluorescence, PCR, or whole genome sequencing. Probable cases did not have that confirmatory testing, but they did have a clinical syndrome of acute onset, rapidly progressive meningoencephalitis, characterized by fever, headache, vomiting, and/or meningismus within 14 days of a water exposure. And then suspect cases had neither the confirmatory testing nor symptoms of meningoencephalitis or a water exposure. So there were some key differences between confirmed and suspect cases. So when we looked at confirmed and suspect on outcome, we saw among the confirmed that we had fewer survivors, their clinical course was shorter, and in the CSF we saw increased white blood cells that were predominantly neutrophils. Among suspect cases, we saw more survivors, a longer clinical course, and less of an increased white count with less neutrophils. So in conclusion, the global incidence of PAM is at least 380 cases, likely more, but that's what we're able to confirm based on a literature search and the US data. The global epidemiology of PAM is consistent with what we've seen in the United States. The demographics are similar. And then in the absence of confirmatory testing, clinicians might be able to use a probable case definition to identify PAM cases because I pointed out the differences, sorry, going back a little bit. There were significant differences between confirmed and suspect, but there were not significant differences between the confirmed and probable classifications. So the clinical definition in the absence of testing seems to be pretty good. And finally, I just want to acknowledge those on my team who are working on some of this. I mentioned my EAS officer, Radhika Garpure. She is working on these 2 projects that I presented, along with Shelley Gleason, and Sarah Collier's been on my team. She's our data, we call her our data ninja, and she's great at all things data and has contributed to a lot of this Naegleria fowleri work. So that's what I have, and if I guess I maybe have a little time, can take a few questions.
Hi. Oh, way back here. Yeah. Oh, sorry. Are there risk factors for? Let me rephrase that. Are there risk factors that make a person more likely to get this PAM, or are there, besides the water exposure?
Yeah, it doesn't seem like it. I mean, it honestly is mostly young, healthy people. There's some suggestion of potential anatomic defects of the nose and sinus system, but I don't think that's ever been systematically seen among PAM cases. So, yeah, unfortunately, I don't think there's any one thing that puts someone at risk except for these high-risk water exposures that we talk about. Yeah.
Very nice, Dr. Cope. It's wonderful to see your focus on this and so on. I wonder if you've been reaching out to your international colleagues. I know that at Pakistan, that's the large number of cases there are reported because someone at Aga Khan took a real strong interest in this, and we think that it's probably happening across sub-Saharan Africa as well, but because people tend not to look for it and don't do autopsies there, it's really not picked up. But perhaps your cool new lamp assay or whatever could be distributed where lumbar punctures are done, and to try and look at some of the incidents of this across the world in the tropics.
Yes.
I was wondering, is there an environmental difference in the lower evident years? Like I see it in 2015, it's a lot less on your chart.
Sorry, where? Can you repeat the question? I'm sorry.
No, I was wondering, is there an environmental difference in the lower year, like the lower evidence years? Like it showed in 2015 that there was a lower evidence of the PAM happening.
Oh, that we didn't have any cases reported, you mean?
Right.
I don't think we have any evidence to say, you know, why there were no cases that year. You know, and I mean, it would be tempting to look at, say, like, you know, the weather data for that year. But I think, I don't know, I think that would be hard to do. And the little bit that we did look at, it doesn't seem like there's a specific, you know, I mean, we talk about, hotter summers and lower water levels and things like that. But I don't know, you know, the analysis I showed with the rainfall and temperatures, I think it's kind of hard to say, you know, that data really didn't support it being like, you know, it was particularly hot in the days before. You know, there was such a wide temperature range and really no association with rainfall. So it's hard to say why that, it's, you know, it's just, again, limited by the low numbers as well. So it's hard to say what might have been different about that year. And again, there could have been a case that, you know, wasn't detected as well.
I was wondering if there were any other species that Naegleria will infect, and in that case, maybe animal model studies.
There's a handful of reports in cattle and a South American tapir. It's just a very random animal. There's no reports in dogs. We get asked about that a lot with people, I'm sure, concerned when their dogs go into a lake, but there's no reports that I'm aware of in dogs. There is a mouse animal model.
Hello. So in regards to the last question, someone had asked what puts someone more at risk. So it's said to be that males generally get it more often. So what, other than like the aggressive rough playing in the pools, what contributes for the males to get it more than girls?
Yeah, we think it's related to activity that. And I've actually been curious. I've tried to look. I feel like in more recent years, we've seen maybe a little less of a distinction between males and females. And you know, are females just as likely to do some of the activities that males are now? Again, small numbers, so hard to say. But we do think it's actually behavior related, and not that there's anything intrinsically about males that make them at higher risk.
These water parks that do
Yes.
not use chlorinated water, you know, natural water sources, are they required to post any warning signage? Says there is a life-threatening possibility of infection. I mean, we have to post warning signs about alligators all over in Florida. So why not that?
Yeah, these we've been calling them novel recreational water venues because they don't fit into a traditional definition of a swimming pool or water, you know, a traditional water park. Which I think when most of us hear water park, we think, I'm sure down here you think of Disney and like, you know, that is all completely treated and disinfected water. So a well-managed and disinfected swimming pool or water park should not be a risk factor for Naegleria fowleri. And there are regulations. They do vary by the state and locality for those type of facilities. On the other end is the natural lake, and I think people look at a lake and say, you know, that looks like a lake to me. I'm not presuming there's any sort of disinfection occurring there, so I you know, generally assume some risk when I go into that type of water. And then there's this whole gray zone. I mean, I've presented here about the whitewater case in 2016. You know, and then the ones I talked about today, these are, you know, I don't know that people necessarily look at these places as a natural setting that I'm going to assume has, you know, the risk associated with untreated natural water, because they are manufactured settings and they might have water that looks kind of okay, but so they've really proven to be kind of, they've fallen through regulatory cracks. Most of them have not had any specific regulations applied to them. The ones I mentioned, the Whitewater Center had not, this BSR Cable Park had not, even though this cable park had an actual swimming pool on site. So there was actual reason to go in there and take a look at what was going on there. And then this most recent one in North Carolina, I think that one out of all of them looked probably the most like a lake, even though there were all these things, you know, added to it to, you know, enhance getting water up the nose. Yeah, they've proven to be a tough situation. We've kind of, you know, a regulation of these is by the, you know, state by state, locality by locality. So we do work and advise these different areas about how they might go about, you know, taking a closer look and maybe applying some regulation to these. But it is something that, so if you're not aware, regulation of swimming pools is actually not, there is no regulation at the federal level, and which makes it hard for states and localities. They have to kind of come up with their own. So at CDC, we do have the Model Aquatic Health Code, which is evidence-based regulatory language for regulating swimming pools, splash pads, water parks, these type of recreational water venues. So it's evidence-based. So there's a whole technical side to it with lots of, you know, all the supporting literature, and then there's actually like regulatory language that can essentially be taken and applied to the local regulatory codes. There is a conference for the Model Aquatic Health Code that hopefully some of your local health departments are aware of, the state and local health. I know Florida is aware of it here at the state level, and basically they meet and they review like you know, issues that have come up. So this, like, these surf lagoons and surf parks are like a new issue that the Model Aquatic Health Code is taking a look at, because right now it currently for the most part addresses swimming pools, splash pads, but even splash pads was like kind of a new thing a decade or so ago. So we kind of had to address that as it came up. So that's an example of something we've kind of addressed as it came up. We were seeing outbreaks of gastrointestinal things happening at those. I feel like, you know, they're fun for kids, but, you know, they all these water things splashing up and they put their behinds on them, and then there was disease risk. So that was addressed through the Model Aquatic Health Code, and so there is a precedent for kind of seeing the new issues that are coming about as a result of our investigations at CDC, and it does involve the industry. So we're getting, you know, feedback from the folks that manufacture the things, you know, manufacture pools and build these type of recreational water facilities, and we're there to say, hey, you know, we're all about having fun, and like, you know, some of these places looks like a lot of fun, but hey, there's some health risks that might be associated with them. So just bringing light to that and trying to address it. Sorry, that was a really long answer, but it is something my group at CDC is really involved with. So.
The cases in Minnesota, I'm over here. Sorry, back.
Why is it so? Okay, sorry.
The cases in Minnesota, were they was Nigeria actually they get the disease in Minnesota, or is it actually people that traveled back to Minnesota?
So when we report states for PAM cases, it's always based on the state of exposure. So yes, the 2 Minnesota cases were both exposed. They had no travel outside of the state during the incubation period.
Was it in the summer months?
It was in the summer months,
Okay.
yes.
Very short question. I was surprised that you measured viable amoebas in a place that had concentration of almost 2 mg per mil of chlorine. So what's a safe amount of chlorine to get rid of amoebas?
viable in one of the ones that had
Yeah.
chlorine.
Yes,
Um,
1.8 mg per mil of chlorine, and still you detected viable amoebas.
Yeah. So I'd have to go back and look specifically what we detected, what sample it was, but if it was like, say, in the sediment or a swab sample, it could have been that we detected it, say, in some biofilm where it would have been protected from the chlorine.
Hi, I'm surprised that tap water and neti pots and nasal irrigation are a potential problem. So I guess my question is, would the water from these sources be municipalities or well water, or, what level of chlorination or, sanitation is required?
Yeah.
If there are cases where that has happened.
Yeah, so we've had, fortunately, just I think 4 or 5 cases officially that were tap water exposures. The first that were identified in the United States were actually in Arizona. Those were related to a geothermal well source. So it was a drinking water well that actually was warm geothermal water. So that made sense that that was, and those exposures occurred. I believe one was in a swimming pool that had just been filled up with the well water and had not yet been chlorinated, and another was in a bathtub. The more recent ones that I'm most familiar with now occurred in 2011 and 2013 in Louisiana, and those were actually the first time we identified Naegleria fowleri in a treated public drinking water system. And so that prompted a big response. I've learned a lot about drinking water management in this position that I might not have otherwise. And it's complicated. I mean, don't take your drinking water for granted, because there's a lot that goes into making it safe to drink. As I've shown here, and as well as recent issues in Flint and New Jersey with lead issues. So there's a lot that goes into making drinking water safe. And in Louisiana, we found there were some issues. There were dead spots in the distribution system where there weren't adequate levels of chlorine. These were chloraminated systems. This is where they add a nitrogen feed to the chlorine, and that's the disinfectant that's used. Some people think chloramination is better for some pathogens, but it may not be better for others. And they've run into issues with nitrification. So it gets complicated real fast in the drinking water systems and managing them. But the takeaway from Louisiana is we found dead spots. Increased water age and temperature plays a role. So the one parish in Louisiana where we had 2 cases was a parish that was heavily affected by Hurricane Katrina and never got that. Lots of people left, not as many people returned. And so when you don't have as many people drawing on the water system, the water just sits. And then it warms up and the chlorine disinfectant dissipates, and then it's not there anymore. Biofilms are an issue in drinking water systems as well. I mentioned that. That's a way that amoebas and other pathogens can be protected from the disinfectant that is added to water systems. So it's that's how, for the most part, our drinking water, we found it's been treated to make it safe to drink. But when it comes to pathogens like Naegleria, like Legionella, like other things that are not from ingesting water, we're seeing risk associated with our drinking water and tap water systems.
Thank you.
Mm-hmm. Oh, sorry. Do you have another?
much higher levels of chlorination and ones that cannot be achieved in drinking water. So, I mean, you need 70 to 80% bleach to kill 100% of acanthamoeba. So in addition to like the tap water cases from nasal irrigation from Naegleria, there have been cases with acanthamoeba and Balamuthia that even if you have proper chlorination of the drinking water, that's not going to save you. And the other part of that is that people think if they use like a Brita filter or a pure filter, it will filter them out, and it doesn't.
What about reverse osmosis? I use it. Nothing bad's happened, but what is your opinion on it?
Using it to treat.
Just to filter water. I
Okay.
mean, it is a filter. It's not like a Brita, but seems to get everything out. It has a completely different taste too.
I don't know
honestly.
if anyone else, I'm not sure about reverse osmosis. So our recommendations for treating, like additional treatment, if you want to use tap water in a neti pot or for another nasal or sinus rinse device, probably the easiest thing to do, not the cheapest thing, is probably to buy distilled or sterile water and use that. The next would be boiling water and then letting it cool. And then after that, there is filtration that works, but you have to pay attention to the type of filter. So just your average Brita filter is not going to be the right filter. You need one that's something that'll filter out, say, Cryptosporidium or Giardia will also work for Naegleria. And then kind of the last line of treatment is doing your own like bleach treatment. But yeah, those are our recommendations. I don't know that we've evaluated reverse osmosis. Mm-hmm. Mm-hmm. Yeah, so the Whitewater Center actually added a lot of water treatment after that case that they weren't necessarily required to do. So they added, I believe they added filtration and a automatic chlorination. So they had actually, they had been kind of occasionally adding chlorine based on some E. coli levels that they would get, but they added automated chlorination. So they already had UV, so they now have like 3 different forms of water treatment that I think have probably improved the water quality. As far as what regulation, there was some additional regulation added, I think, at the county level. That's where the regulation for that park was added. I don't recall the specifics of that regulation. At the surf park, I have just mostly seen through I haven't heard a lot about that. The surf park closed down shortly after we were there on site last year. Essentially, they closed down for the season because we were there at the end of September. They closed down for the season and reevaluated their water treatment. From what I've seen online, they added water filtration, which certainly should help with that turbidity level that they had. And they did reopen then later, I think at the beginning of this summer season. Yeah. All right, well, I'm happy to take any additional questions after, but